Welcome back, class. I think we're gonna wind this module up here. I don't want to say fairly quickly because a lot of what we're going to talk about with respect to ethical importance in healthcare professions, we've already talked about some of it in some of the earlier segments, but I want to make sure we hit home and to make sure that everybody understands the importance of ethical decisions or ethical practices when it comes to healthcare profession. And the first one, it's a guide. It guides decisions regarding treatment protocols and efficacy. Again, remember we talked about when you go in to see your physician, you want the physician to have the best interest of you, the patient. That should be his or her number one priority. And so it guides these decisions regarding your treatment protocols and efficacy. You want your provider to have an open mind, to be looking at all the potential options, and to put together a treatment plan that's going to drive the highest probability of a positive outcome. And then kind of secondarily to that, you want the patient to trust in the healthcare system without reservation. Maybe some patients can. I personally can't. I guess I've become cynical. Been in the healthcare field for more years than I want to remember. Worked in the university hospital when I was at Ohio State. It is just difficult for me to trust in the healthcare system, without reservation. Unfortunately, I can't. They used to laugh at Ohio State. What do you call what are they going to call the individual that finishes last in the medical school class at Ohio State? Going to call, him or her doctor. And you go in to see your physician, and even if you've done your homework before you go in, went to a top medical school, did an internship and residency at top programs, you're making the assumption that individual, because they went the route of the top medical school, top internship, top residency, you're going to make that assumption that that individual, that physician or that healthcare provider is going to be better than the provider next door in that medical practice that may not have gone to the greatest medical school, not attended a residency program or an internship, maybe at the top hospitals or the top institutions in the United States, because it's going to depend on, kind of where they fell in those classes. Were they at the top of the class? So, do you want somebody that went to the best schools and the best residency program internship but finished at the bottom of the class? Are they going to be better than the one that finished mid-level or maybe top of the class of the competition? So that's what you're juggling, and that's what that drives some of the asymmetric information that we as patients have access to, because we don't know the positioning and we don't know, and the quality of education ebbs and flows over medical schools, depending on when they went to the medical school. Was it better then than when it is now? So it's just really difficult from my perspective. And again, I'm probably just have gotten cynical over time, but I just cannot trust the healthcare system without reservation, especially if I go in and I have some options that, seems somewhat drastic. I'm going to get a second opinion, and I may get a third opinion, especially when it comes to the treatment protocols that I'm uncomfortable with. You want the ethical importance in healthcare profession. You want to mitigate patient-provider asymmetric information. And again, goes back to that principal agent relationship. You've got potentially patients withholding information. You've got providers over here that have access to a greater wealth of information, but you may have SID, that supplier-induced demand, creeping in. So you wanted to mitigate that patient-provider asymmetric information, or you can call it the principal-agent relationship. You're interested in evidence-based treatment protocols because, in theory, they should optimize outcomes. So you want a provider, or at least I want a provider, that is up to date. I want a healthcare professional that is staying up to date on the latest treatment protocols, the evidence-based treatment protocols. Are they looking at medical journals? Are they going to society meetings? Are they reading the information they get from the American Medical Association? My treatment protocol or my treatment plan, I would feel a lot more comfortable if it was evidence-based treatment protocols, because I feel like I would have a higher probability of a positive outcome. You want mutual trust across medical staff decisions, optimal treatment outcomes versus financial incentives. And this one to me is interesting. So, and I think they're talking about in this situation, they're talking about either large, integrated medical groups or large medical groups in general, or hospital settings in which they want the staff. So the staff decisions, they want those staff decisions, they want them to be comfortable and trust in each other's staff decisions. You don't want individuals, especially in a hospital, especially in the emergency room of a hospital, you don't want them second guessing each other based on the decisions of their colleagues are making when it comes to treatment protocols or the strategy of improving your adverse healthcare situation. And that's also, it talks about optimal treatment outcomes versus financial incentives. Again, in the emergency room especially, most individuals working in an emergency room don't have access to the financial relationships between the hospital and the health plan. They certainly don't have access, well, I can't say certain. For the most part, they're not going to have access either to what the relationship is between the hospital, the contractual relationship from the hospital across varying different types of health plans. So they won't know the difference between Aetna, from Cigna to United to the Nashville, Tennessee Blue. They won't understand all of the financial nuances with those contracts. So it makes it a little more difficult for individuals working in those situations, especially staff situations, to understand the financial situations. But it's pretty easy for somebody in the administration to understand those financial situations, and somebody in the administration to dictate optimal treatment outcomes, especially those that are going to drive more revenue or more financial incentives for that particular healthcare provider, especially if it's a hospital. You want the ethical importance to identify the least obtrusive and the most benefit treatment plan. Again, go back to my knee example. The least obtrusive was probably going to be, physical therapy and going to a gym and some exercises to kind of strengthen my knee and try to work out the issues. Kind of the more radical is just, hey, we're going to take you in tomorrow, we're going to give you a new knee. And that's where you're balancing, as a healthcare professional, you're trying to balance the desire for the positive outcomes of the positive treatment protocols among all of your potential options. And from my perspective, only go in, and again, it's back to the cynical nature, but only go into a hospital if that's your last resort, if that's your last option. Uh, I'm always up for. I'm always willing to try anything possible to keep from having a surgical procedure, or to keep from going into a hospital, or keep from going into an ambulatory surgery setting. Uh, because if I'm going in for a surgical procedure, that's just, from my perspective, that's just increasing the probability of negative outcomes. And then administrators manage an environment conducive to optimizing a patient's health status. Again, it goes back to administrative driven decisions based on optimizing my health status, as opposed to being dictated by some type of financial arrangement. And trust me, especially if it's a hospital, and we're having financial issues, it is the administrator's responsibility to ensure that they right the ship, that they turn things around, that somehow they are either maximizing revenues, minimizing costs, some combination of those help drive profitability to ensure that they're going to stay in business. So things can get difficult if you're a hospital administrator, or if you're a medical group administrator, or if you're the medical group manager, if you're the practice manager for a medical group. Your priority is to keep your eye on that bottom line. Are you maximizing revenues? Are you minimizing costs? Because those two in combination are going to drive your profitability. And then lastly, you've got state, federal guidelines, regulatory compliances. They all have to be maintained. Hospitals have credentials, medical groups have credentials, physicians have credentials that have to be maintained. We talked about HIPAA. You want to make sure that, data security, data integrity, that, you're taking care of, whether you're on the health plan side or whether you're on the healthcare provider side. You want to ensure that you're taking care of the members' healthcare information, because you don't want that breached and you don't want to have a healthcare information issue. So, and I think that's going to take care of this healthcare ethics. The next time we get together, I think we're going to talk about the economic impact of healthcare ethics. And when we're talking about economic impact, we're going to get back. I don't want to say get too far in the weeds, but we're going to go back to things you learned in your micro classes: production, theory of the firm, production decisions, profitability decisions, margins, those type things. So again, whether when we're talking about business ethics, or healthcare ethics, or medical ethics, or clinical ethics, it all can be distilled down to: what are the drivers? What are the parameters, or what are the drivers that are going to determine the decisions that individuals in a healthcare environment are going to make? Again, it goes back to opportunity cost, self-interest and optimization, decisions at the margin. And we'll get into some of those when we talk about the next module, but those are going to be the determining factors, and those are going to be the factors that are going to drive that decision-making process. Talk to everybody when we get back on the next module. Thank you.